Hello, my name is Dr. David Orries. I live and work on the Lower East Side of Manhattan, and I'm talking today about a restaurant worker healthcare cooperative. This healthcare cooperative we started is an example of what's called a not-for-profit model for healthcare, to provide healthcare. It could be used as a model for statewide healthcare, regional healthcare, or even national healthcare. What it does is it brings forth the discussion of for-profit healthcare versus not-for-profit healthcare, which ought to be the conversation, not uninsured or insured. So the Restaurant Worker Healthcare Cooperative is a cooperative we started, modeled after what are called food co-ops. Works the same way. Basically, restaurants chip in a little money every month into a common fund, or like a coffee pot, a bank account, and that money is collected in this account every month, so it's a couple $1,000s a month. Then what we do is we provide healthcare services for all the workers at those restaurants. So 10 restaurants might be 300 workers. So then they can get basic health care, and when they come to see the doctor, they get treated and they leave and they don't pay anything, and the money's taken out of the common fund.
Hi, my name is Dushan. I'm one of the owners and bartenders at Employees Only in West Village, New York. I found out about Dr. Dave's healthcare co-op through our involvement as a restaurant in it, and I found it to be an excellent thing for everybody. I like the fact that we as a company can afford it to have everybody covered, if you will, in a way where they can get a responsible and solid health care. And for such a low cost that comes out of our pocket as ownership, we feel very good about it to be able to offer our employees such benefits which we wouldn't be able to do if we would go to regular healthcare programs.
We provide general medical care, or just a general ambulatory office, meaning not an emergency. We don't do heart attacks, heart transplants, things like that. But we do any kind of general medical care. You know, I cut my finger, burnt my hand, I have a headache, I have a cough. It doesn't have to be work related. It could be any kind of illness. I think I have diabetes, my foot hurts, I sprained my ankle, no matter what it is. The goal, as far as you guys are concerned, what I'd like to have happen is let me decide if you need a doctor or not. I can prescribe you a generic version of a medication, which is only $4 a month as opposed to $100. We could also get you the medicine for free from patient assistance programs through the corporation that makes the medicine. And we also have other ways to get you medicines for very cheap or very inexpensively for ongoing prescription. When you see me, I don't discuss it with your employer or your friends or your coworkers. It's private and confidential. So in closing, I want you to call me or text me when you think something's wrong. Don't wait to find out what happens. I don't mind. Just text me or call me. It takes me 2 seconds to figure out what's going on, and I can decide to see you or not, okay? That's the end of the lecture. Thank you so much. Well, over the last 10 or 15 years, I get a lot of patients who work at restaurants. They show up with cut fingers and hurt hands and coughs. And what I began to notice over the years is that they come in too late. They wait 5 days, 10 days, 20 days to come see me. And I asked them, what are you waiting for? And they told me, I'm waiting for it to go away. I'm waiting for my pain to go away. They can have a lump in their breast. They can have abdominal pain, ectopic pregnancy, toothache, infection, all these things they can have. And what they're waiting for is it to go away. Why? Because they don't want to see a doctor. They can't go to the emergency room because they're going to get billed for $2,000. They also don't want to go to hospitals because they might have immigration status questions. They don't want to be, found out to be working, especially if they hurt themselves at work. So they don't want to go to doctors. So the structure, the system prevents them from coming in, which is perfect if you're trying to make profit. If they don't come in until they're dead, you make more money that way. What's your name again?
Roberto.
What you said you're having pain here, like heartburn, acid?
Acid. Pains?
Are you taking Nexium? How much? One a day.
One a day.
You can come see me during the week, but what I would tell you to do is take Nexium in the morning and Prilosec in the afternoon, so 2 pills for maybe a week. There's a company that went bankrupt yesterday in the United States called GM. You might have heard of them. They make cars. They went bankrupt, and what they said on television is the biggest reason they went bankrupt is they couldn't afford the healthcare cost for their retired staff and workers. So if we did, in this fantasy world, have a national not-for-profit healthcare system, then GM would not go bankrupt because they wouldn't have to pay healthcare. So when you have a not-for-profit healthcare model, another big advantage is your healthcare services are not connected to your job. So if you lose your job or get fired or quit or move away or do something else, you don't lose your healthcare because they're not connected. Only in the United States of America, out of 190 countries, this is the only one on the earth that connects your healthcare to your job. Nowhere else is that true. It's a complete, unmitigated disaster.